Here's today's 5-minute medical update. Welcome back to this last segment in this very long-running, sorry about that, series about mask and asymptomatic spread and some recent data and controversies. Part 5 is called 1,000 Backtracking Scientists Can't Be Wrong, and the Era of Feeling Over Fact. Now, how does this get to a place like Mountain View, Arkansas? How is this relevant to you and me? Well, over the last week, I've heard one sentiment regarding the connection between the current conflicts over coronavirus and the protests and riots around the country. I've been asked the following. So, Doc, what's up with me not being able to come into your office or go into a restaurant without keeping a 6-foot distance and having a mask on, but it's okay for thousands of people to protest and riot without any masks or any social distancing? Now, there may be a little bit of exaggeration in this because a lot of the protesters are wearing masks, but the point is well made. Now, to show just how quickly a big, fat, juicy consensus of over 1,000 scientists changed their scientific consensus based on the opposite of science, something you and I call emotion, let me share with you the following. Earlier this week, we see that over 1,000 scientists that had previously stated that it was so crucial between March 13th until the Black Lives Matter protests began, that we stay in social distance, that they did a total turnaround, that they had been so zealously wedded to and had gone so far as to claim failing to social distance is murder. I want you to look at these headlines. Over 1,000 health professionals signed a letter saying, don't shut down the protest using coronavirus concerns as an excuse. And, listen, how limiting protests will spread the virus. I've still not been able to figure that one out. Now, looking at this and quoting them, I want you to know what they said in the following, and I'll show you some pictures to illustrate. As public health advocates, we do not condemn these gatherings as risky for COVID-19 transmission. We support them as vital to the national public health and to the threatened health specifically of black people in the United States. We can show that support by facilitating safest protest practices without detracting from demonstrators' ability to gather and demand change. This should not be confused with a permissive stance on all gatherings, particularly protests against stay-at-home orders. Interesting. Particularly against those protesting against stay-at-home orders. And instead, they say, we wanted to present a narrative that prioritizes opposition to racism as vital to the public health, including the epidemic response. We believe that the way forward is not to suppress protests in the name of public health, but to respond to protesters' demands in the name of public health, thereby addressing multiple health crises. Boy, those safest protest practices really worked out, didn't they? So let me ask you a question or illustrate this. So this is okay, but this is bad. This is healthy, but this is dangerous. And our right to protest is more important than our right to protest? By the way, any of you know how much property damage, murders, beatings, theft was done in the name of stay-at-home orders versus the ones that we've seen rioting and looting? How many people were hurt and how many businesses were burned with protest against the limitation of our right to assemble, go to school, work, or worship? Not one report that I've heard of. This from the same people that said abortions had to continue when all other elective surgeries were delayed because abortion was life-sustaining. I quote, the governor of Michigan said that abortions were life-sustaining. Now, just take a deep breath, get your composure, come back, we're going to finish this. I'm a little shocked myself. It is literally amazing to watch these people with no core value greater than the worship of and desire to gain political power over their enemies to turn themselves into pretzels. So 1,000 health professionals can't be wrong, right? Except they are. These are hypocrites that are blinded by their hatred of anyone who threatens their established power idol, political power. So drawing this all together into a close, I want to share with you two things that the World Health Organization said that despite their research ringing true and being controversial because it went against the prevailing political winds, and by the way, I want you to know I'm still wearing my masks every day. I'm a law-abiding, supporting citizen. I'm going to follow the governor's executive orders to the hilt, and my employer, I want to respect our authorities. I'm not going to do anything that might possibly infect the vulnerable. Now, despite this, and despite the fact that I'm wearing masks, and despite the fact that I'm having to do some things that I don't like, and I digress here a little bit, I want you to listen to what even this scientific article that makes good sense with good data descends to when they start telling decision makers why it's important for people to wear masks. And here I quote, amongst other things, they said, wearing masks is positive because it reduces potential stigmatization of individuals wearing masks to prevent infecting others, that is, source control, or people caring for COVID-19 patients in non-clinical settings. Whoa! So even without good data, do it because we don't want anybody to feel embarrassed. Okay? Number two, they said, it makes people feel they can play a role in contributing to stopping the spread of the disease. So without data, do it because it'll make you and others feel good, and I guess they followed with a chorus of kumbaya. Folks, we are in an era of feeling and emotion over substance by far. If we don't come back from it, it's just a matter of time before our enemies within and without have us right where they want us. Whenever there is a threat to an establishment with power, that establishment will often stop at nothing, including sham trials and murder, to keep the status quo. Just ask Jesus of Nazareth. On second thought, you might also ask the Jews in Germany in 1933 or young black men in Mississippi in 1965. A final summary. We've seen a great example of scientific consensus being misused to quash information that didn't fit with the politically correct accepted narrative. Never believe consensus science doomsday predictions. They just want to get into your wallet and through fear make you turn over more control to them, inching closer and closer to their socialist utopia. Think how willing we have been to let the government encroach on our God-given, Constitution-ratified freedoms in the last 3 months because of the fear of the unknown. And just a thoughtful question. If the socialists want to get rid of the police and prisons, how is it that whenever socialists, look at this list, take over a country, it always winds up in what we call a police state, with more prisons and more prisoners than ever under capitalism? You ever heard of the Gestapo? Just food for thought. Science has been much corrupted by political correctness and the desire for political power. Use your common sense. Okay, enough from me. That's my story and I'm sticking to it. I'll be back after July the 4th weekend because I need to retool and improve my skills to better try to bless and to serve you with information that can help you live a larger life long term, which is the mission of what I'm doing here. Thank you very much for your attention. Have a great rest of June, and hopefully when I see you again, this thing will be nearly over. Have a good week.